Okay, guys, Dr. Mackey again, continuing on with our policy discussion. This is policy 5050. It's on destination. Now, we're a non-transporting provider, but it is important for us to understand also the reason why destination decisions are made. As we've talked about in prior discussions together, there are specialty receiving facilities in our area. Stroke, STEMI, and trauma are the ones we've already talked about. There's also burn centers, which is UC Davis, and pediatric trauma centers, which is also UC Davis. Most all of the destination decisions are made by the patient or the guardian. Occasionally, there'll be a prepaid health plan request. And then finally, law enforcement can also put a request in about where to take a patient, but in the county's rank order, they are at the bottom. I do want to take a moment to talk about law enforcement. Law enforcement will retain primary responsibility for safe transport of patients under arrest. So a patient that is being detained, if they are in handcuffs, an officer has to accompany that patient in the ambulance. And if patients under arrest are on psychiatric detention, should be searched thoroughly by law enforcement prior to any transport. Now, on occasion, we will require direct medical oversight for arriving at destination decisions. These are going to be rare. So probably the best example is someone who meets one of these special triage criteria, like, for example, they meet critical trauma and they say, nope, you're going to take me to Sutter, and Sutter's not a trauma center. In these situations where it's requested by the patient, the family guardian, or private physician or law enforcement, that's the time when we are going to make base contact and get direct medical oversight. Or if the patient's condition is unstable and the destination normally the person would go to is not the most accessible facility, so say like that they're a critically unstable STEMI patient and we need to take them to a non-STEMI facility because they are too unstable to make it, that would be direct medical oversight. That requires base contact. And then, of course, in MCIs, the control facility is going to be dictating a lot of our destinations. Here's the other kind of new addition is patients under CPR that were found in initial shockable rhythm, and they have return of spontaneous circulation during any part of the resuscitation. Those folks need to go to a STEMI PCI center. Trauma patients that are unstable should be taken to the most accessible hospital as well. Okay, guys, that covers this policy. We'll see you on the next one.